why should one record his experience? See, I have had experience in various fields. Recording my experience will help us, them, will help you, will help me to understand the path we have crossed. Not because that anything is great there. It will understand the situation, the mistakes we have committed, the improvements we have made. All these things will be made to you so that it will be helpful to us to follow. That is the main aim. So, what is medicine? We try to cure my experience is mainly with allopathic medicine. I am not comparing any system or this one. Whatever I meant is mostly personal experience. Now, they used to say very quietly, the King Akbar was in his throne, and there are usually these 9 people who were in his Sabha used to surround him. He asked one question, what is the oldest profession in the world? They said, everyone blinked to each other. Birbal stood up and said, prostitution. They just laughed at him at wonder and they looked at him, but they had a discussion deeper. Yes, that is right, because only 2 partners, no charge fixed, a little physiological, no other fee fixed. It seemed to be the ideal thing. The king also agreed. Then the king immediately say, the king derives his knowledge from others and gets opinion from everybody. So the next question he asked is a very simple question. Is there any profession in this world one can practice or one can do without any prior knowledge or without any commitment? He said, again the people were thinking at each other, because everything, agriculture, engineering, anything, you take up any profession, you are sewing, threading, needling, cooking, everything requires some experience working under somebody. But there is one profession. Birbal stood up and said, my lord, there is one profession which anybody can practice without any previous experience. I was wondering, what is it? Medicine, my lord, he said. Is it? Then they went deeper. Yes, if you are sick, one will say you go and take rest, another will say you will meditate, third will prepare a hot cup of coffee for you, the fourth will prepare something else for you, the fifth will say you go and sleep in this one, the sixth will say we will continue and dance with some other so everybody will suggest a cure without understanding the problem, or with understanding the problem, with or without any concern. That is medicine. Medicine was started from the ages, but this is a true recorded story and told to us in one of the meetings by one of the very senior people. I don't want to disclose the name. So, medicine has been in practice for a long time. But there is still another story, which is for any story considered with philosophy, we go to the East. Usually there are Chinese origin, and any story related to sex, you go to Arab with Arab Nights. These two we are familiar from a long time. This one, the king was enthroned, the doctor was by his side, and you will find that always there is a doctor in any king. See, even today when a president goes or when the chief minister goes, the convoy, there is always an ambulance and a doctor. So like that there was a doctor there, and the doctor is permanently placed. The doctor is third son, he is a third in the family of doctors. The king asked the doctor, doctor, you are the third son, you are the youngest in the family. What are the other 2 brothers are doing? What is your eldest brother doing? What is your other brother doing, next brother doing? He is a little honest fellow. He turned to the king, my lord, my eldest brother is the one who lives in a village. People don't recognize him as a doctor. He prevents a disease even before it comes up. Supposing somebody has died with chicken pox or smallpox, he isolates them. He only treats them, he isolates them in a hut. Supposing there is a typhoid breakup, he goes and visits the laboratory and says there is a mixing up of fecal matter with the drinking water. And then he sees, he prevents the disease from coming. That is, he is the one who really prevents. A stitch in time saves 9. He prevents the disease, but he doesn't give medicines. That is, his aspect is mainly preventive aspect, and like we study in social and preventive medicine. So he is interested in preventing the disease. People don't recognize him as a doctor. He is given very little attention. He is given very little respect. That is what is happening even today. This preventive medicine aspect, excepting the government, the private sector gives no respect for the doctors. And luckily, this is slowly coming up. They are getting recognition. My chief used to say, the clinicians have stolen the cake, the non-clinical people have not tasted it, he will say. So, this is the fate of the doctor who is in the village, who prevents the disease from coming to the patient. He prevents open defecation. He prevents fecal matter from polluting the water. He says you should not walk barefooted. Like he says you should drink water only after boiling. All these good habits are taught by him, and his presence in the village prevents a disease. But he is not earning enough. My next brother is the one. Once a disease is diagnosed, he lives in the nearby town. He prevents the disease from getting into complicated. Supposing somebody has got a diabetes, hypertension, or some other disease, he finds out the disease early so that it does not reach the complication. That is, from the onset of disease to the onset of complications, he prevents the disease. He postpones the onset of complication. Prevention of disease he is not able to do, but once the disease is coming, he is preventing them. This is the second stage. He is getting just enough money to keep himself. If a fever comes, he treats them. Cold comes, he treats. Pneumonia, he doesn't allow it to progress. He says if there is diarrhea, he doesn't permit dehydration. Like all preventive measures he takes, he doesn't permit obesity, hypertension. Like the non-communicable diseases of today, which the government is taking very great care, like control of diabetes, like that he is taking great care to he is better than me, but he is inferior to the my eldest brother. He just makes enough money to live for himself. I don't give. You know me, my lord, I am with you. I am the third stage. That is, when the complications come, I come in. I do renal transplantation, I do cardiac transplantation, I travel with you. Sometimes you send me abroad to treat other kings also, kings and queens. I am considered as the next one. I am given a place next to your throne. I get all the privileges, but I treat even I do liver transplantation. I do whatever I want, I get it, my lord, and I am able to support my brothers. That is a fate today. It is an inverted cone, my lord. My elder brother should have been given the greatest chance, but not. I am given the greatest respect which he deserves. I am treating only 0.05 of the population at a greater cost. When I do a liver transplant, it costs 20 lakhs. When I prevent them from drinking and smoking or getting addicted to obesity or drug addiction, that is the greatest to the family and to the country, my lord. People are not realizing it, my lord. Even today, people are not realizing this. These three stages must be clearly defined. People should be taught on health. In fact, one of my familiar topics, my oration topic was in 1997 when IMA was this onset of the second stage. Why people were very much interested in listening. Actually, every professor wanted me to talk on advances in hepatology or advances in gastroenterology. They came prepared, but they were surprised to see me talking about how to prevent complications in common diseases. So, a thing which you should receive common, that is, you should prevent illness. You should prevent illness from progressing further, and the people should be taught well. This should be the aim of the government. This should be the aim of the public. You should have a good drinking water. You should have a good supply. The open defecation must be avoided. People should have a good shelter. People should have good healthy food. They should avoid drinking. They should avoid smoking. Drug abuse is becoming very common. These things should be avoided. From the we have progressed much faster in medicine, but not because of any advances in the world, but because of healthy living in this world and more cleaner atmosphere, that we should realize. So people should realize the significance and start in the correct line. Is being careless at the earlier stage and spending crores at the and getting glamour for things which are not necessary. Even today we find people attend hepatic transplantation cases or renal transplantation cases or liver cardiac transplants much part when they don't understand a part of it. They fail to attend how to do an MTP, how to prevent illness or a family planning cases or common illnesses, and so the doctors and public must concentrate more on prevention and must give less important. I am not see every life is important. You realize when you are sick, because I am not saying that is. See, but you should not be spending crores and crores on things which you live for few years with disability and omitting with for few thousand rupees you could have cured the whole village. Now the scheme of adoption of the villages have come. Doctors have come to realize, not only doctors, it is the public and the press. They want to cover what is glamorous. See, what is glamorous is not useful. What is useful is not glamorous usually. So you must always think what is useful to you more than what is glamorous.